news, the Lagos State government plans to shift management of mild and asymptomatic COVID-19 patients to primary health centers. This will serve as a springboard for the government's plan to treat such patients at home, leaving the isolation center for serious cases. Our correspondent Theophilus Elama was at a briefing where the commissioner gave a situation report.
In the fight against COVID-19, the Lagos State government has been hands-on in ensuring the state gets rid of the novel virus. So far, 21 local government areas are on the map, with Etiosa, Lagos Mainland, and Ikeja amongst the top 3 LGAs in the geographical distribution of cases.
Sometimes it's 20%.
The Lagos State Commissioner for Health says plans are in place to revamp the primary health centers as the government plans to embark on home treatment of COVID-19 patients.
To cope with the numbers of positive patients that we're seeing, we've incorporated what we call the home-based care, or the decentralization of isolation to the community, and we will be looking for homes where people can be adequately isolated in their private environment, which doesn't pose danger to other members of their families or to the community at large.
About 59% of the cases are mild, 38% of them are moderate, and 2% are severe, and 1% are critical cases. The proportion with comorbidities, we have about 75% of the cases without comorbidities, and 25% of them have comorbidities.
Lagos State has over 200 primary health centers. This will prove to be an important aspect in the state's fight against the global pandemic. According to the analysis given at the briefing, 60% of COVID-19 cases are mild and asymptomatic patients. To flatten the curve, the government believes primary health care centers have a huge role to play.
In this dispensation, we have gone to extreme lengths to strengthen the primary healthcare platform. We've instituted very competent governance boards. We're about to strengthen the infrastructure. We've employed a significant number of more staff at the primary healthcare level.
Most important is that the community at this point must take ownership of that care. And if community is able to take ownership of that care, that means the issue of stigmatization will go down. They will also be able to offer psychosocial support to members of their community.
While giving situational analysis, it was revealed that the state has done about 35,000 PCR tests. With this in mind, the state government says it plans to also build more isolation facilities that will cater for severe cases of COVID-19. Theophilus Elama, TVC News, Lagos.